Childbearing and raising children are considered significant events in the life of most couples. Therefore, when a couple fails to bring forth a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse, then they are diagnosed with infertility.
People asking me, 1 year, 2 years, and we're just getting like, where are these children? And then there's the insensitive comments from people, there's the solutions everyone has.
With various causes of infertility, Lydia, a wealth manager, is one in many women whose infertility was caused by Polycystic Ovarian Syndrome, more than a year into her marriage, but unsuccessful in getting pregnant.
I went to a fertility doctor, who then we did 3 cycles of IUI, and still the pregnancy didn't happen. And then now after that we did take a break.
Women with PCOS will experience a range of symptoms such as excessive hair growth on their chin, around their breast, and experience weight gain, among other symptoms.
Fertility, I think, is what drives most of us to see a doctor.
Find the other places are proportional, but the abdomen can be a little bit bigger than the other places. May have issues with mood swings because of the hormonal imbalance which comes with Polycystic Ovarian Syndrome. You may have issues with low libido as well, issues with diabetes in future, the risk of having endometrial cancer, and so on and so forth.
For Lydia, she tells us that she experienced irregular periods, which she did not take as a challenge, even though it is a PCOS red flag.
A regular cycle is 28 to 32 days. So for mine, it would be 35 to 40 days, 42 days. I was not too worried because for me, my mind was like, the period came every month. There was some period. So it's not too scary that it's not coming at the correct time. Then on top of that, add the stress of getting married and preparing for a wedding. So for me, I was like, this is just stress.
According to Dr. Kireki Omanwa, there are interventions to PCOS, such as regularizing a woman's periods, change of lifestyle, including choice of foods, or eventually choosing medical interventions like insulin sensitizers to help them get pregnant.
What does that mean? Insulin is a hormone that helps us make use of glucose, or the sugar in the body. In Polycystic Ovarian Syndrome, there is insulin insensitivity, meaning that the body is not using that sugar that we give it. So a lot of it remains in the bloodstream and it's changed into fat. So what we want to do is to increase that sugar to go into the cells and be utilized. So that's some of the medications that we use.
However, the cost of infertility treatment has locked out many women from seeking for such interventions, a call being made to the government to intervene so as to help women who would otherwise wish to have children.
NHIF used to, I'm saying used to, because I think it stopped paying for this service, I think about 2 years or 3 years ago. And even then, it used to cover only for civil servants. So there was not a bit, I think it was discriminatory, because why are you paying only for civil servants and not the general population?
Robbie Omondi, K24.